Hi, my name is Dr. Peter King from the Australian DBT Institute. This brief video will introduce a hierarchy of targets that can guide individual therapy sessions. This approach is part of a stabilisation based therapy approach that we use at the Australian DBT Institute. The basis of this approach is that we firstly focus on an individual being both safe and then able to use resources to maintain and continue that safety and stability before we start doing any deeper therapeutic work. So we leave the conversation, the processing trauma, looking at stressful memories until somebody's safe and feels comfortable working in those areas. So we have 5 targets in this hierarchy of targets. Number 1 being risk to self and others. Number 2, the therapeutic relationship. Number 3, connecting with resources. Number 4, integrating those resources that you're now connected with. And then 5, that deeper therapeutic work that I was just mentioning before. So the point of this is that number 1 is risk. So if there's risk present, that becomes our main focus of our individual session. An individual's safety within individual therapy is a therapist's primary concern. If you or somebody else are at risk, we focus on ensuring safety of everybody involved. This may require a whole range of different strategies, resources, but also support and direction from other clinical mental health services. Again, we maintain confidentiality, but also ensure that somebody's safe. Number 2, and this is really important, is the therapeutic relationship. So if there are any barriers to receiving therapy or for the clinician to provide therapy, we address these immediately and we prioritise them. The only thing that takes a priority over the therapeutic relationship is risk, making sure that somebody's safe. The third priority is to help individuals connect with their individual resources. So at the Australian DBT Institute, we use Stabilisation Based Therapy and DBT to connect individual with new and existing resources. So we sort of prioritise the acquisition and accessibility of these resources before we get you to use them in stressful everyday life events. So it's better to learn how to draw first before you enter an art prize. The next target, we focus on using those resources. So the resources that you've acquired, we start working on integrating those resources into your everyday life. So we talk about and we support individuals to start using those resources in more stressful situations. We start in easier situations and then apply more pressure as we go on. So the last target, number 5, focuses on processing and insight. This means that we use the therapeutic approaches that we feel comfortable and well trained in order to help individuals gain insight into a range of experiences, events, and memories. We suggest that you speak to your individual therapist and make sure their approach fits the type of approach that you would like to use. Most therapists have a website, and you can look on our website for our therapists who will explain exactly what they focus on. Now, if you've got any questions, remember that second target. Your therapist is wanting to make sure your treatment meets your needs, and this approach needs to be clear. And if it's not, we focus on ensuring that we answer any questions that you may have.